I'm going to quickly go through WinOMS software, walk through a patient's chart, and then I'm going to go over like our schedule, the color coordination of appointment type, and the abbreviations. And I'll also walk through just some extra stuff that's in WinOMS and how to use it and how to find it. The account that I'm going to be using is my account, so there's no protected information. There's nothing that I can't share. Nothing's even current, like my chart. There's stuff like insurance information that's from 2013 when I was 18. So no insurance information is accurate. There's nothing on this account that you can steal. So let's get into it. Let me, oh, actually I need to share my screen. Present now, entire screen, share. Okay. So I'm going to open up WinOMS. To search a patient, you're going to go to patients. You're going to type their last name here. So I could do ASH, comma, hit enter. I can't do it right now because it'll pull up other patients' information. I could do comma, Mariah, and do it that way. It'll pull up all Mariahs. Anybody who you've recently accessed is going to be right here. This is not login specific, it's computer specific. So if I search an account on the computer in the clinical room right now or the surgery room, it's not going to come up on this one. It's only what I have on this computer. So ASH, PAG, hit enter, pull this up. Okay, so all alerts, you're always going to read these every single time. This is potentially life or death information. You do not want to make a habit out of just hitting close. You need to read this every single time. So we can close it out now. This first page is demographic information, address, phone number, social, general dentist, emergency contact. Again, nothing on here is current. And like even stuff that was current, I deleted it off so you couldn't see it. So that is that. I'm going to go to ledger. This is going to show you everything this patient has ever been here for. So for me, I was here in 2014. I had a pano. To see the most recent, you scroll all the way to the bottom. These are just hepatitis B vaccines for work. But let's say you're bringing back a post-op and you're trying to see, you know, like, is this a 1-week post-op, a 2-week post-op, and what was it for? This is going to be the best place for you to go because it's going to have everything that's ever been done. Instead of having to scroll through multiple notes and surgery notes, this is the quickest, most efficient way for you to do that. And I talk about that in my post-op video. We're not going to be doing the claim window. That's not really important for anybody in the back. Attachments. This is going to show all our images. This is going to also show any images that were sent over by the general dentist. So we have this OMS imaging tab here for CareStream that's going to open up our imaging software. It's only going to show, this one specifically, is only going to show x-rays that we have taken in the office. But if they send over x-rays that we have not taken, like for instance, this or this, you need to be on the imaging side. So you're going to hover over it. It's going to show the date that it was taken, which is important because we need to know that our x-ray is within 6 months from our consultation, and it needs to be within the last year of our day of surgery. So that is important. Documents, you'll be looking for a health history. My account is old, so my account says patient registration form, but again, mine's an old account. You'll be looking for health history. And then you're going to open up the health history. I've done a video on the health history, also showing how to go through that. But you pull up their health history, make sure that there's nothing in there. And then we'll skip to treatment plan right now. Treatment plan is going to show what we are doing. If it has a money bag next to it, that means it has been paid for and possibly already done. So you need to coordinate what your schedule says versus what your treatment plan says. So if it says that they're here for an implant, but the only treatment plan is showing like for wisdom teeth, that's obviously not going to be the correct one. This is important because let's say the mouthwash that we give, at the bottom here, it would say Paradex. If they've paid for it, it's in their treatment plan. If it's in their treatment plan, it means they paid for it. So we need to give it to them. So that's how you're going to know if we're giving them mouthwash, is if it says Paradex. I think when I had surgery, we sent it into my pharmacy, which is why it's not on my treatment plan. So I did those steps to show those are the most important. So when you come in the morning to set up a room for surgery, before you even start setting anything up, you need to go through your patient's chart. The reason you need to do it before is because, let's say you're like, oh, I'll just set up first and then I'll look. Let's say you are setting up, you put lidocaine on the tray, and then somebody comes and gets you and says, hey, can you come do this? You walk away. And then let's say you get distracted, other things happen, and you never look at that chart. And then somebody takes the patient, puts them into the chair, we start surgery. On that tray is lidocaine. If there's something in their chart that says they can't have lidocaine, maybe it's an alert, maybe it's a part of their health history, maybe they have some sort of cardiac issue that we really shouldn't have been giving them lidocaine, or maybe they have an allergy to it. So if you didn't look, then it would be that we end up giving them lidocaine, and it's a never event. It's something that should have never happened in the first place. So you will always look at your account first. And the order that you're going to do that is you're going to open the account, you're going to look at the alerts and see if there's any allergies, anything that's of concern. Then you're going to go to your images and look that the x-ray that we're using for surgery is within the last year. That's very important because let's say we're doing wisdom teeth and it's a 14-year-old girl and now she's coming back and she's almost 16. We have that nerve that runs through our jaw that gives us feeling. Those roots are still growing. So if we're performing surgery based off where those roots were in that x-ray from a year and a half ago, they could be in a very different location now. And if we're doing surgery and those roots have grown, we could be at risk of giving her nerve damage. So you need to check your x-ray and make sure that it's current. Then we'll go to documents. Again, look for our health history. Make sure there's nothing in our health history that would concern us for today's surgery. And then we will look at our treatment plan to make sure that we have everything set up. Because just because something like on the schedule side may say extraction and implant. But then in the treatment plan, it may also say bone grafting. So the appointment note on the appointment, like the scheduler, may not be able to include every minute detail of their treatment plan. So you need to view their treatment plan and see their full treatment that we're going to be giving. So recap again, alerts, images, health history, treatment plan, every single time before you set your room up. Okay, just making sure I'm still recording because earlier it kicked me out. So then from here, we're going to go to contact notes. Contact notes is internal office communication. Any conversation that you have with a patient or somebody else in the office that relates to this patient's treatment plan, their finances, their insurance, speaking to the general dentist, all that communication is going to go into contact notes. This is very important because if we don't document it, it didn't happen. So if I call the general dentist or they call me and they say, hey, for this patient, we only want you to send pieces X, Y, and Z. I'm going to put new, and then per general dentist, so-and-so, they only want pieces X, Y, and Z. And then I'm going to save it. So that way, when we go to send pieces, I see that note and we send them what they want. The other reason is, let's say I call general dentist and I say, hey, what pieces do you want? But they don't answer. So I leave a message. Hey, I have patient, Mariah, date of birth 3696. I'm just giving you a call. I wanted to see what restorative pieces you wanted. Go ahead and give me a call back so we can discuss it. So I would put a note in here. I would do new, type it up, spoke with left voicemail. So, and I would write that left VM, shorthand, left VM for dentist. Told them to give me a call back. Or I could also put just wanted to know what pieces they needed. So if they call back and the front answers, the front's going to come to me and they're going to come to me directly because they saw that note that I put in, and they're going to say, hey, so-and-so is on the phone. Or they could read the note and just say, oh yeah, she called. She just wanted to know what restorative pieces you needed. And they'll be able to tell us, rather than the front calling and say, yeah, somebody from your office called. And the front has no idea about what or who. And then they run around all over the office. Did you call so-and-so? Did you call so-and-so? Did you call so-and-so? Did you call so-and-so? And then maybe I'm in the bathroom. So then they go back up to the front because they can't find me. And they say, yeah, I don't know who called you. We'll have to give you a call back. It's very disorganized. This is just a way of making that organized and straight to the point. This is also going to be how we communicate with each other. So contact notes is also docking. So you can see up here, doc patient. To do that, you're going to use this little tab here. Are you still there? Stay in call. That's why it kicked me out earlier. Good to know. So we are going to minimize to doc. And then this is my doc. So I'm going to use this little notepad here. Let's say I want to communicate with, Dr. Pham. I could put his name. I'm just going to do it under mine, but you're going to say, hey, AP. So you're going to put the person's initials that you're talking to. We are testing doc notes. And then I'm going to put my initials, the sender, MMA. Hit OK. It's going to be a little wonky because I'm sending it to myself. But now up here, it shows that I have a message from somebody. Usually you would click this notepad and it'll show you the note. I don't know that it's going to do that for me because I sent it to myself. Yeah, no. Usually it would show it. But I'm going to open it. Go to contact notes, scroll down. Hey, AP, we're testing doc notes. So if that was a note, like I actually had a question for Dr. Pham, I would say, hey, we need to know what we want to do with this patient, da, 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 da. And then he would doc me back and say, oh, hey, Mariah, I just want this, this, and this. And then I'll get that message from him. So this is a way we can communicate with each other. I'm going to delete that. I don't want it on my account. Letter and statements, that's not a tab you'll be using in the back. We already went over treatment plan. You really won't be using these two in the back. Those are just insurance and charges. This is our imaging tab. Scanning, if we're going to scan something in. Attachment, this is going to be if there's a file in our computer that we want to upload to their account. And that is the minimize to doc. So now we're going to go to the EMR side. So our hope is that everything that's in their health history imports to this, but I check it manually every time because there could be an error where it doesn't cross over and we don't want to miss something. So it says my medical history is a family history of cancer. I take no medications, no allergies. Then you have the prescription tab. If I opened that up, it would show any prescriptions that we sent. That's going to be important to send prescriptions. You may not have authorization to send prescriptions, but if you do, it will be there. The other thing is that we want to see that we've sent prescriptions. So if somebody asks, oh, did you send prescriptions? I would open up that tab and I would see the dates listed down the side, and that would show me the most recent. So if we did surgery today, so today's 2/17/24, I'm looking for a prescription on 2/17/24, or maybe they had a consultation and we sent prescriptions in on that day. You can check consultation date, see if prescriptions were sent. But if I don't see any date on there, I don't see any prescriptions called in, or the only prescription I see is from 2021, then obviously we haven't sent those. So then I need to go tell the doctor that prescriptions were sent. Or if somebody says, hey, what prescriptions did you call in? I can go to the prescription tab and I can say, oh, we sent in Tylenol 3 and amoxicillin. This tab will also have the instructions for the prescriptions on it. So if you're doing a callback and the patient says, how often do I take this medication? You're going to go to that prescription. Let's say it's amoxicillin. I'm going to say, we called in 21 tablets. The directions are that you take one every 8 hours until complete. So that's where you can find that information as well. So use that to your advantage. You don't need to go ask somebody, hey, did we call in prescriptions? You can very easily see it there. You can see the directions for the prescriptions, and also remind them that the instructions for their prescription are on the bottle. And yeah, so then the only other tab, implants. If I open this up, I don't have any implants. If I did, it would show me the date that it was inserted, the type of implant. It'll also say the tooth number. So if we add one currently, sorry, I just keep checking back to make sure it doesn't kick me out again. So add a new implant. We can enter the lot number, the tooth number, fixture. If I do these 3 dots, I can do find. It'll show me every implant in our system. Let's say we place a 3.7 by 10. I'll search 3.7 and then hit these dots, and it'll show me all of our 3.7 implants. So here's a 3.7 by 10. I'll make sure that this reference number matches, and then I'd hit OK, and it would import. System, you can do find. It'll do every implant system, or if it was a Zimmer, you could type Z, and now it'll just give me Z systems. Bone quantity, bone quality, bone status. You can ask the doctor what these are, or you can leave them blank. But you know, that's not as important as what this information is. You can ask them what this is. Provider, it's going to be the doctor who's placing the implant. Arch, upper or lower, so is the implant on the upper jaw or the lower jaw. Anterior, is this tooth in our smile line? Is it a front tooth? Posterior, is it a back tooth? Edentulous, edentulous means a patient who has no teeth currently. So this is going to be if you're missing all of your teeth and we're placing implants, and those implants are going to snap into a denture. Bridge, it's going to be if we're placing an implant here, we have a space in the middle, but that tooth is kind of floating onto those 2 teeth that are on the implants. Single is just like a regular single tooth. It's just going to be a single implant with a single crown. Prognosis, it's usually always going to be good. Exposure date, if it's already saved and they're coming back and at that 4-month appointment, there's going to be a little pencil here to edit. So you'll edit it and you'll put the exposure date in. Then prognosis is good. Prosthetic, fixed bridge for obviously a bridge. Single crown is going to be for single. Fixed detachable is going to be for the edentulous denture patient. Restorative dentist, you can do that and put in who their restorative dentist is. Our anesthesia tab, I'm going to do a separate video that's going over the whole anesthesia log, but this is where you would go to add one or to print out the record. Notes. Mine, like I said, we use for testing, so this kind of that's why this whole note is empty. But to add one, go to plus. We don't do fans notes, so I'll change it to Maharaj, and this will show us all the templates for Dr. Maharaj. This date needs to be the date of the procedure. So if for some reason we need to add a note that wasn't today, like let's say I'm doing a note for surgery on Friday, I would need to change that date, and then we would save it. I have in the new employee packet, I went through and I printed out a copy of each note, and then I also went through and added information because there's going to be things in this if you're new that you and if you don't have experience in dental or you don't have experience in medical or both or vice versa, you may not know what some of these things are. So I went through, let's see, histological study. I printed that out, and then next to it, I wrote this is going to be for a biopsy. I explain what, like non-resorbable, resorbable. When you see our post-op notes, it says WNL. If you're not going to just know out of the blue what that is. So I wrote next to it within normal limits. So I went through, I printed out every single note that is in our system, and I have thoroughly gone through and explained each individual word. I've explained everything of what that is, and that's going to be in your new employee packet. Please do use that to your advantage. You need to know through and through. Goodness gracious, I can't talk. You need to know through and through what these words mean to be able to fill out your note accurately. And that is all I use on this tab. I don't use anything else. So prescriptions, implants, anesthesia, notes. Everything else I access from the workspace tab. So that's going to be it for a patient's account. The only other thing, let me go into an explanation of, let's stop presenting. So when you go through our schedule, everything is going to be color coded. So red is extractions, and implants are dark green. Implant consultations are light green. Extraction consultations are orange. Follow-ups and post-ops are yellow. Biopsies are gray. Consultation other, I think, is still orange. Also, you will see, I don't want to pull up the schedule because I'm so far into the video, I don't want to accidentally show patient information. But common abbreviations when you see on this schedule, PO, post-op, FUBG, follow-up bone grafting, CWIS, consult wisdom teeth, WIS IV, wisdom tooth IV, EXTLO, extraction local, IMPLO, implant local, IMP IV, implant IV. I think there's OTFU, other follow-up, COTH, possibly consult other. When you go to the appointment window or the scheduler, if you double click, it'll pull up the appointment type and it'll show you what that abbreviation means. And when you double click, you can also expand that appointment and be able to read the entire note there, because sometimes if it's really long, you can't read everything from the schedule. You have to physically open it. There's also, you'll see when you double click it, the third tab over says audit log. You can see all the appointment notes that's ever been changed. You can also see if the appointment date was changed. It'll show you appointment date was changed from 2/17 to 3/2, like March 3rd. Or you can see appointment time was changed from 11 to 3. So that'll show you your audit log. It'll also show you like when somebody added details to the note. To open the patient's account, you will right click and then scroll down to patient workspace, and that will open the patient's account. So I think that's it for that. I'm going to go through some extra stuff on WinOMS. So extra things, you can show all offices, just Lansdowne, Chantilly, or you can do all and it will put them side by side. You can just show by provider. You can scroll through the schedule this way. File, it's going to show you like your printer setup, scanner setup. If you print screen, it's going to give you a screenshot of that schedule. You can also go to your search bar and do snipping tool and print your screen that way as well. Reports, there's a lot of financial reports, but the one that we can use in the back, you're going to do patient implant tracking. So let's say you know that there was a patient who you removed an implant or you placed an implant within the last month, but you can't remember who it is. Rather than scrolling through your entire schedule, you will just say like, okay, we placed it sometime between January 1st and today. And then you would hit print and then preview, or you can print it. It'll just waste paper, but you can do preview and scroll through. It'll give you the whole log of that. Same thing if you're looking by somebody for the exposure date. You can also search by restorative dentist. You can search by provider. So there's many things, a way to track those implants. None of these other things you use. We can do tables, note templates. This is going to be all our active notes, the ones that we currently see. You can also uncheck that. It'll do every note that's ever been in our system. So we'll do active. do find. So let's say there's a word that's spelled wrong or you need to make a change to the note. Let's open biopsy. So let's say, I don't know, let's say severe is spelled wrong. You can go in and change this. Or if you want to add something like, I don't know, like at the next visit, do whatever. So that'll change it in every single patient portal. It'll change it to where a new template, when you go to write a note, it'll pull up looking like that. The other thing is you scroll down to the bottom under practice vendors, find, well, display all, just kidding. This is going to be everybody that's in our account. So this is all pharmacies. This is all implant sales reps. This is everything. So like our building, the company that handles the building, like their contact information will be in here. Utilities, you can change your password from here. That's probably the biggest one. Windows is very important because let's pull up my account. Open. Okay, so let's say I'm doing something. Usually the biggest reason you'll use this is for your anesthesia window. So let's say this is my anesthesia window and then I start opening up other things and then now that's disappeared. I'm like, oh my goodness, where did my anesthesia window go? How am I going to get that back? You go to Windows and then click right there. It'll pull up any tab that you have that's active that you didn't physically close out of. And through here, that's how we search patients. So we can search by last name, first name, date of birth. Anybody you recently accessed will also be there. And provider. So we can search our general dentist with this window. This is going to be our schedule. So you can open that. This is our time clock. So how to clock in and out. And that is really all that you're going to use on here. Again, you know, your doc notes, if somebody messages you, that'll pop up there. But that's just kind of the bare bones, kind of how to get through WinOMS and how to access things. A lot of it's just going to be repetitive use and figuring things out, but I hope that kind of clears some things up for you. So yeah, that's it.